Hi everyone, and in this video I'll be discussing drugs for pulmonary hypertension. In pulmonary hypertension, the first category of drug what we use are calcium channel blockers. In calcium channel blockers, we have two. One is called the dihydropyridines. DHP stands for dihydropyridines, and one more is non-dihydropyridines. In dihydropyridines, we have two drugs. One is amlodipine, and one more is nifedipine. One more is nifedipine, and nifedipine what we use is sustained release formulation. The non-DHP what we use is diltiazem. It is called the diltiazem. The second group of drug what we use in pulmonary hypertension, these are called prostaglandin I2 analogs. They are called prostaglandin I2 analogs. So what is the name of it? They are called epoprostenol, then treprostinil, and a drug called ileoprost. So PGI2 analogs are epoprostenol, treprostinil, and ileoprost. The third important group of drug is a drug called prostacyclin receptor agonist. So what is the name of it? It is called Selexipag. It is called Selexipag. The name is Selexipag. Now, fourth category of drug, you all know they are phosphodiesterase 5 inhibitors. They are phosphodiesterase 5 inhibitors. There are two which we use. One is called tadalafil, and one more is sildenafil. Tadalafil and sildenafil, they are phosphodiesterase 5 inhibitor. By inhibiting that, they increase cyclic GMP. By increased cyclic GMP, they cause vasodilation, and that's the reason why we use it in pulmonary hypertension, because in hypertension we need to dilate the blood vessels. The fifth one, recently they have started using inhaled nitric oxide. Inhaled nitric oxide is preferred in pulmonary hypertension in neonates. Pulmonary hypertension in neonates, we use inhaled nitric oxide. So this was asked in one of your recent exam. Please keep in mind inhaled nitric oxide. Number 6, we have something called endothelin in the circulation. This endothelin can cause vasoconstriction. So if I want to use a drug for pulmonary hypertension, I have to block this. So we have endothelin receptor antagonist, and the name is bosentan. We call it as bosentan. Then we have ambrisentan. Then we have macitentan. Now, how do I remember this? Remember ENT. So ENT means endothelin. A for antagonist. It's an endothelin antagonist. So remember as entan. The drugs ending with entan, they are endothelin receptor antagonist. The 7th drug is an oral drug. It is called oral soluble guanyl cyclase. It is called oral soluble guanyl cyclase agonist, and the name is called riociguat. So it is riociguat. So these are the drugs what we use in the management of pulmonary hypertension. So what is the role of guanyl cyclase? Guanyl cyclase will convert GTP into cyclic GMP, and that is responsible for vasodilation. So these are the drugs what we use in the management of pulmonary hypertension. CC-based PGI2 analogs, then prostacyclin receptor agonist, that is called Selexipag, Then phosphodiesterase 5 inhibitor, sildenafil, tadalafil. Then we have inhaled nitric oxide, particularly in the neonate pulmonary hypertension, where you use it. Endothelin receptor antagonist end with NTAN. Okay, then the oral guanylyl cyclase agonist, that is called riaciguat. So you can read the name here, guanylyl cyclase, guat. Okay, so that is about drugs for pulmonary hypertension. Thank you all.